Hello friends, I am Dr Sourabh Patwardhan from Nandadeep Eye Hospital PG Teaching Institute and FECO SICS Training Center, Sangli, Maharashtra, India. In our center, we have a lot of teaching activities which includes hands-on training as well. In this video, I am going to show a case where I operated on a very VIP patient from our area, and what I was thinking during the case, because I get a lot of questions from my colleague like how to approach a patient who is a VIP, a very close relative or maybe a very important person in and around that area. So how do you approach that particular case? What is the thought process? So I think the most important thing which I feel at the beginning is that you have to gather your thoughts, and it's better to slow it down a bit. So what are your usual speed of surgery is there? I think it's not. It's a good idea to just slow it down at the beginning so that you become more calm and your mind is more composed now, because many time at the beginning we are overthinking about the results, how the case is going to go, if there will be a complication, and whether I will be able to manage the expectations of the patient. So it's always better to slow it down a bit. Always be ready with a plan to begin with. So for example, this patient I knew, he's a 75 plus year old gentleman and he is on tamsulosin. So I wanted to make sure that the pupil doesn't misbehave during the surgery. So even if it is a mid dilated pupil, I decided to use the BHEX pupil expander ring here. The anterior chamber depth is little bit on shallower side, but it's okay. It appears like a grade 2 cataract. In that couple of minutes after I started the surgery, which is much slower for as compared to my usual surgeries, I kind of compose myself now, and it's always useful because now you have got your thought processes right. You know that your muscle memory is really good because we have done so many cases before successfully, that stays with you, so you don't have to worry about that. I always use the usual or the regular instrument that I use in my regular surgeries, so I don't change or I don't use any special instrument for these cases. And the basics are very important. So I know here that I have to regrab the capsulorhexis stair after every 2 or 3 clock hours, and I should not exceed that. So those basics, when you kind of keep doing that in your regular cases where you go according to the rules, you don't skip any steps, it helps. So now I'm just decompressing the anterior chamber there, and I'm going to use very controlled hydrodissection hydro wave. You can see that I immediately saw the hydro wave. I decompressed the bag and I could rotate the nucleus. Now here, if the nucleus doesn't rotate, I'm going to repeat that steps that I'm very clear with. So no skipping of steps. If you feel any palpitation, anxiety during any of the steps, just wait, take deep breaths, compose yourselves again, and then you can go ahead. Now my plan is very clear. Here it's a grade 2 cataract, so I'm not going to do anything else. I'm just going to do a stop and chop. Here again I saw the cigar sign which I have mentioned. So I always look for that red glow at the end of the trench there. Once I know that I am ready to divide it, and it is going to divide very nicely. I am using my usual chopper, which is a Patwardhan 1.5 mm chopper there, and now I go ahead with the chopping. This is a grade 2 cataract. I know how much I have to bury into the nucleus. Now at this point, usually your spinal reflexes take over. So you kind of now you know that you have done so many surgeries beforehand, so you don't have to worry about it now, and you kind of now go little quicker now, and because your muscle memory is taking over now, you don't have to actively think what you have to do. Your visualization what is happening, so you are looking for any signs which are probably telling you that you might have to do something different, but here everything is going fine. So I know that everything is as per the plan. I could pull out the first piece from the back, so the remaining pieces are going to follow. The settings I have kept are again as the usual setting which I keep in standard grade 2 cataract in my practice. I am constantly watching the posterior capsule as well for any anterior chamber fluctuation as well. So those are the things which happen now by reflex, so you don't have to worry about. And you can see that I am comfortably continuing the case. So all those surgeons, once they achieve particular level of experience, they are going to get more of these VIP patients. And there is always a first time for doing any VIP case, and that is something you should not run away from, because many times I've seen surgeons that they're so afraid that they tend to refer that patient away. But probably you have to think, if you're good at your regular surgeries and you are a thinking surgeon where you are focusing on each and every basic step, you are following it, you will be able to do any case without any complications, so you don't have to worry about that. About plan B, so always make sure that you have the other IOLs also ready. For example, here I have planned a trifocal IOL for this VIP patient, but I am going to keep a 3-piece IOL also, just in case if it is needed. So in at the back of your mind you have that safety net, that if something goes wrong I can still put a 3-piece IOL in this particular patient. So that is something you should be ready with. You should have everything up and running, like vitrectomy set should be there. So if needed you should be able to use a new vitrectomy set for anti-vitrectomy if something happens. So at this point the patient became a little bit kind of, he was moving his legs, and so I just steadied myself. I was planning to remove this B hex ring before the visco wash, but I decided that let me do visco wash first. And I could see that one of the haptic is still stuck to the optic, so I also wanted to make sure that it's completely releases before I take out the B hex ring there. So I'm going to remove all the dispersive and cohesive OVD which I have put during the procedure. And I always use cohesive OVD for IOL implantation. It is very useful because it keeps the backfill. At the same time you can wash it off very easily, and it comes out in one go, and usually don't have any residual OVD in the eye at the end of the surgery. So these patients, you don't want them to have any complaints later on, irritation or the redness, photophobia. So you want the anterior chamber to be completely free of OVD. Now as the haptic got released, I decided that now I will put some cohesive OVD here and remove the B hex. Cohesive, why? Because again it's easier to remove. So I want to remove the B hex ring now very carefully. By this time the patient is also now calm. So you must remember that even if you are operating on a VIP patient, he is also a regular patient, so he or she is going to be little bit of having anxiety himself or herself. So it's very important that you should be calm yourself, so you can give them assurance. You can have some words before the surgery. I generally myself don't talk much during the surgery, just give brief instruction at the beginning, and then I just at the end I tell that everything went well. So but if anything, patient is not having patient is not cooperative, or again having some anxiety issues, you can speak to the patient in between just like regular case, and that will calm them down as well. So a lot of things, I think there are many experienced surgeons also watching this video, so they can put their points as well, that how you prepare when you want to operate on a VIP patient. So looking for your comments there. Thank you so much for listening.